Kiranji, after you announce your thoughts on, as a chairman of medical education committee, whatever the knowledge and education is, it needs to be translated into practice. So what is your thought process of how to make this happen? And I have already made Uday commit his
Yeah,
support to
yes.
guide you for a lot of things, along with a whole bunch of us who are ever enthusiastic to do. And after you speak and some Sampath speaks, we will again relaunch the Karnataka chapter. We are piloting this e-certification course. Dr. Kasturi Donimat was not there when we just put the 10-second video, so we will replay that again. So Kiranji.
Thank you, Dr. Hema. First of all, for giving this opportunity, and congratulations for taking this wonderful initiative. Dr. Hema, what I've heard, I've been hearing since Dr. Anil Kapoor and everybody has, from Dr. Kasturi, Dr. I mean, lots of views have come, practical things points have come out. One point which I felt, one thing is that you were talking about postgraduates. See, as a medical education committee chairperson, I feel the postgraduates are those beginners. If we strike them at the right point, each and every one, then definitely they will adopt, because whatever we were taught in the postgraduate days, that strucks to your brain completely, and then you can always follow. It's actually, even though everything has been said, so much good percentage and so much good results, still, we know that many people still in various areas are still hesitant or not aware. 1 or 2% will come out who will ask after the meeting, madam, isme kya karna hai, ye kaise karte hain, kya difficulties hain. Even certain difficulties I've seen with the lab people also have talked, like they will give it, and then between those 2 hours they will allow the person to move around and go to the other places. So that part, I mean, the finer things are lost. So the postgraduates are we target them really all over India or even outside. That can make the difference. Of course it will take some time, but will take a great difference. So this idea of launching the postgraduate courses, e-courses, is definitely going to add up a lot of benefit. And as Dr. Uday said, one more point, it was very wonderful of him talking that the DIPSI test has made a mark on the in the chapter of the of gynecology and ops. But still, we need to take it now to the wider platform, even to the world we are, because we are able to prove it. We have done it wonderfully. The results have been shown perfect. So now definitely there is this is the right time to take it to the further world platform. So that's also a very good idea. And thirdly, I would just like to say one more point, because I have been just added, maybe the time is short. Dr. Sampath Kumari I'm lucky to have her as a vice president. So this will further help us together if we are able to take it, because she will also be we have also worked during the adolescent committee, and we'll also work now. So as a medical education committee chairperson, I would in fact request and honest ask each and everyone to come with further posts and the initiative vigor to take this initiative forward. Thank you, Dr.
Excellent.
Hema.
Yeah,
Thank
excellent.
you.
Thank you,
Thank
Kiranji, for joining, because yesterday we were together at Kanpur and we brainstormed on this idea, and she was kind enough to join us today, because we
No,
want this larger, wider, deeper, not only pan-India, but also in the CEFOC countries and African countries, and to many other low-middle income countries. And they are very, very keen, but they need to have their competence and confidence a little bit tuned in. So with these courses, I'm sure that it will strengthen and it will give us the role model edge. You know that we've done it, why can't you? Kind of a thing. Thank you, Kiranji.